This is a supplemental audio for the neonatal pulse oximeter delivered by IGH. Pulse oximetry is a type of screening that can pick up lower than usual blood oxygen levels. This type of screening is done 24 hours after birth to allow the baby's heart to fully adjust to life outside the mother. This method is extremely simple, using sensors placed on the skin. By monitoring this, you can prevent illness in the baby even before they become sick. Pulse oximetry may be also used in screening for congenital heart disease, CHD, which is a defect in the formation of the neonate's heart. In extreme cases, the baby may develop critical congenital heart disease, CCHD, which is a severe category of CHD and is life-threatening to the baby. About 1 in 4 babies who have CHD have CCHD. To treat CCHD, the baby requires surgical repair, oxygen therapy, or prostaglandin E1 injections. This type of screening is very time-sensitive because of the implications of being diagnosed with CHD or CCHD. A normal pulse oximetry screening result does not definitively rule out the presence of CHD or CCHD. Therefore, hospital staff should remain vigilant for any warning signs in the infant. However, if the newborn fails the screening, a follow-up is necessary. Some of the warning signs to look out for are difficulty feeding, difficulty breathing, grunting, fast breathing, irritability, excessive sleepiness, bluish color to the skin or lips, poor weight gain. Contact the baby's doctor if any of these issues arise. The objectives for this audio are to measure the oxygen saturation of the blood, to identify where on the skin to place the sensor, and to set the monitoring system. There are many different ways to use a pulse oximeter on a baby in terms of the baby's anatomy. In today's audio, we will explain placing the pulse oximeter using the leg approach. Step 1. Place a pediatric foot pulse oximeter. These will be smaller in size and are designed to fit smaller toes of babies. Step 2. Choose a comfortable position for the baby. The baby may be placed on your lap or a soft surface such as a changing table. Step 3. Select a toe with good blood flow. In general, the big toe or index fingers are good choices. Make sure to clean the area of the skin of the baby with alcohol. Step 4. Attach the probe. Gently slide the probe over the baby's digit and secure it in place. Step 5. Wait for the reading. Wait a few seconds for the pulse oximeter to register a reading. The reading will show the oxygen saturation level and heart rate. Step 6. Interpret the reading. A normal oxygen saturation level for a baby is between 95 and 100%. If it is lower than 95%, consult a healthcare professional immediately. Step 7. Remove the probe. Clean the site with alcohol. In cases of abnormal result where the baby has an abnormal pulse, additional screening must be done. This includes, but is not limited to, chest radiology, blood work, or echograms. While the machine can detect an abnormal pulse, this does not necessarily mean that the baby has a heart defect, meaning that there can be false positives. In cases where the baby has lowered oxygenated blood levels, this may be attributed to infections or even lung problems. Accurate readings. Here are some factors identified by the FDA or the U.S. Food and Drug Administration that may affect pulse oximeter readings. Poor circulation, skin pigmentation, skin thickness, skin temperature, tobacco use, and fingernail polish. Some precautions to keep in mind. 1. Warm your fingers up before placing them on the device. 2. Position the probe correctly on the baby. 3. Make sure that the baby is as still as possible. 4. Make sure to remove any nail polish, finger tattoos, or henna dye, as these can interfere with the reading. This training podcast has been recorded using Northeastern University's audio equipment and produced by Northeastern University.